If you're studying hematology, there is one cell you absolutely cannot ignore, the reticulocyte. It is young, it is active, and it tells you a lot about what is happening inside the bone marrow. So today we are breaking it down completely. Erythropoiesis, the process reticulocyte is the second last stage. After polychromatophilic erythroblast loses its nucleus, it becomes a reticulocyte. It still has a residual RNA inside it, which forms a net-like pattern, that's why called reticulocyte. The normal count is 0.5% to 1.5%. Here is the key fact. About 0.8% of your RBCs are replaced every single day. Now, when retic count goes up, whenever the bone marrow is working overtime to produce more RBCs, like in hemolytic anemia, in response to treatment when you give iron, B12 or folic acid to an anemic patient, a rising retic count tells you the treatment is working. And third, recent hemorrhage, when there is sudden blood loss, thalassemia, pregnancy, erythroblastosis fetalis, in HBC disease, leukemias, and in hypoxia. When retic count go down, when bone marrow is failing or it is suppressed, it simply cannot produce enough cells. For example, in aplastic anemia, megaloblastic anemia, plastic syndrome, in cirrhosis, there is liver disease that reduces erythropoietin production and causes marrow suppression, anemia of chronic diseases. Radiation exposure directly destroys marrow, and when there is decreased adrenocortical or anterior pituitary activity. So, when do doctors actually order a reticulocyte count? There are three main situations. First, when evaluating a patient with anemia to find out that marrow is responding, or second, to monitor treatment response in iron deficiency, B12 deficiency, or folate deficiency anemia. Third, to assess overall bone marrow activity, especially before or after chemotherapy or bone marrow transplant. Key point is low retic in an anemic patient means marrow itself is the problem. For example, you can remember high reticulocyte count Heath, and for low reticulocyte count AMCRP. And that is reticulocytes completely covered. If this helped you, hit that like button, subscribe for hematology videos.